Hey dance team, let's do a melt method roller sequence for the knees. So we're going to be focusing actually not directly on the knee joint, but the tissues that surround it. So let's start with the hamstring. I'm going to put the roller right where my legs begin, and I'm going to keep my legs as relaxed as I can. I'm going to drag my heels away from each other and then toward each other. So I'm going to turn my toes out, turn my toes in. Go about 5 or 6 passes, just drawing fluid to this area. Then we'll make our movement smaller on top and just kind of wiggle like you're scratching the back of your thighs on the roller. And we'll pause and then find a new spot on your hamstrings, maybe closer to that, the end of it near the knees. So again, we'll start again, that sweeping motion, toes turn out, toes turn in. You want to feel your flesh kind of twisting on the roller here. And then we're going to go to the calves. For all you dancers, this is a fun one. So you want to make sure that your feet are relaxed, just kind of dangling there, hanging there. And set the roller on the medius part of those calves. And we're just going to bend and straighten the knees. Make it small, make it slow. And then I'm going to tip slightly to one side. You'll probably find some surprises in there. And then slowly come back and go to the other side. So you're on the outside of one leg, inside of the other. And now I'm going to come back to center, and then now I'm going to contract. So I'm going to draw circles with my feet, or letter U's, flex and point. You want to feel those muscles contracting against that roller. All right, now we're going to go to the inner thigh, and that's going to require you lying on your side. So I'm going to set my knee on top. Notice I'm kind of near right at the inside of my knee. I'm going to angle the roller slightly out away from me, so I push it out a little bit. And my foot is on the ground, just to take some of the pressure off. This can be really sensitive. So what I'm going to do is just let my pelvis my whole body fall forward and go back. Forward and back. And remember, you want to be as relaxed as possible here. You can even keep your legs straight, and I can turn my toes down, turn my toes up. This is the gliding part, and then now we're going to pause, find a spot that's a little sensitive, maybe you have a little barrier there. Bend and straighten your leg. Just let your foot drag on the ground, or you can hover it. Either way. And then I'm going to keep my knee bent, and I'm going to, from my hip, pump my knee up and down here like I'm scratching an itch on the roller. And then pause, take a breath. And then move the roller up closer to the groin. So again, kind of find that spot where I can shift forward, shift back, just kind of rock my body forward and back. 5 or 6 times. Then I'm going to pause on the inside there and then bend and straighten the leg. Some of you kind of said ow when we did this on Tuesday. And then bring that knee up and down here. Again, rubbing that skin against the roller. Now we're going to work our way all the way around the thighs. So I'm going to come up onto my forearms, turn my body at an angle, and then now I'm going to push the roller down. So now I'm on my quad. And again, I'm not rolling on my knee. I'm going to just get my quad right near the knee. And again, my foot is relaxed, leg is relaxed here. So now I'm going to come to a spot that might have a little barrier, a little tenderness, maybe a little lumpy bumpy. Pause there, and then I'm going to bend and straighten the leg. Same thing we did with the inner thigh. And then to do that scratch the itch one, we call it, you're going to go side to side. And then now you're becomes probably the most sensitive part for your knees. We're gonna keep rolling, continuing on to the outside of my thigh. So this foot's down to relieve some of the pressure. My hands are down on the ground as well to take some of that pressure off. And we're gliding on that lower part of the outside of my thigh. This is my IT band area. And oh mommy, there's definitely something there. If you don't feel this, you're not doing it right. But again, we want light pressure, right? We don't want it to hurt. We just know that something's happening. I'm gonna find a spot. There it is. I'm gonna bend and straighten my knee here. If that's too much to handle on this, just keep gliding. Do that movement we just did. Oof. And then I'm gonna keep my legs straight, and I'm gonna go forward and back with my pelvis here. So, oh boy. All right, now come on down. We're gonna do the same thing on the other side. Okay, now I'm doing my other leg. I'm gonna come down, lay down on my side. Again, I'm gonna put that roller right near the inside of my knee and kind of angle it away from my body. Then I'm gonna fall forward and back as relaxed as possible here. This is our glide, drawing tissue or fluid to that tissue surrounding the knee. I'm gonna pause on a tender spot. I'm gonna bend and straighten the leg. And then keep the leg bent from the hip. I'm gonna move that knee up and down. Pause, take a breath. And then slide it in further up the leg and do the same sequence. And you can do the whole inner thigh. You can do multiple spots on the inner thigh. I'm just doing 2 in light of time, but this is your area. You can do 5 or 6 places. I'm gonna bend and straighten. And then knee up and down. All right, now we're gonna continue getting more of that quad. So I'm gonna turn my body on my forearms here, push the roller down so it's above the knee, right above the knee, and then I'm going back and forth. Oof, right there. Find a tender spot, bend and straighten the leg. Oh boy. Pause, and I'm going to go side to side here. Or you can do a little bit of that motion as well. Just make sure that leg is relaxed. When we contract, we block that fluid, so we don't want to do that. All right, now we're going to continue on. Come to the side. This is that spot, really sensitive for most, so make sure you take some of the pressure off with using the rest of your body. And gliding on that lower half here, my outer thigh. And then I'm going to pause, bend and straighten. Yikes. And then leg is straight, and I'm going to move my pelvis forward and back here. Okay, so now I'm going to do a little bit of release in the hips as well. So I'm going to slide that roller right under the widest part. My 2 hip bones are on this side of the roller, on my side. If I pick my knees up, the roller doesn't move. And actually I'm going to stay here. I'm going to put my hands here. And now I'm going to slowly march this. This is shearing the SI joint, and it might look familiar because we do it in the low back sequence. We'll be doing it in the hip sequence too. This is in all of them, and it's always good. I'll slightly tip the knees to one side. And then the other. And then then now I'm gonna set one knee down, bring one knee in. I'm gonna take a breath in, and then exhale. Bring that knee in toward my chest, tuck, and feel the lengthening in my hip flexor right here. And then let's switch. Take a breath in, and then exhale. Curl your spine, tuck your pelvis, draw your knee toward your chest, and then we're energizing through this hip flexor here. All right, and then we'll take that out. And that is it. See you next time.